Hello and welcome to Midlife Moments with Dr G. I'm Dr Georgina Hale, Specialist Medical Doctor and PhD in midlife women's hormones. So someone asked about bone health and what they could do with bone loss or osteoporosis or osteopenia. Now, bone loss always occurs. So everyone loses bone around perimenopause, menopause. But we can minimize the loss. So, but why do we want to do that? Because the more bone we do lose, the more likely we're going to have fractures and catastrophic fractures when we get a lot older. Hip fractures. Everyone knows about hip fractures in the elderly, and they can be death. They can cause death because the mortality after a fractured hip in an elderly person is very high. So what can we do about that? Well, I think we need to be aware of who is at risk and am I at risk. So I'll go through some of the risk factors that will hopefully make you aware that are you at risk? Will make you aware of the risks so you can ask the question, how can I address my risk factors? So one of the highest risk factors is if you have a family history of osteoporosis, your mother particularly, or even on your father's side. People who have a small frame and have small bones to start with, they are at higher risk. People with low body weight, people who have excessively dieted during their whole life, who've been underweight during their whole life. If you're a lady who hasn't had normal periods and skips periods a lot, that could be a factor to increase your bone loss or have less bone density as you're getting older. Some of the lesser known ones are stress. Stress is associated with high cortisol, which is associated with bone loss. Inflammation, again, that's probably to do with stress, but it's also one of the factors we're not really well studied on, and that's inflammation and autoimmunity. Now, autoimmunity can lower vitamin D, which can give you a higher risk of excessive bone loss as you go through a midlife and the menopause. And another lesser known one, which I see so often, is irritable bowel syndrome, so IBS, whether it's constipation type or a diarrhea type. And they are often associated with low vitamin D and possibly reduction in other nutrients like calcium. And another one would be excess alcohol. That probably has to do with stress, the gut health, etc. So there are a number of risk factors that you can ask yourself, am I at high risk? And how can I reduce those risks? You can't really reduce your family genetics, but how can you offset those risks to lower the bone loss that does occur normally through the perimenopause and menopause, probably starts at midlife. So what I would do, if you are one of those people, please check your vitamin D level. Now, do this whether it's recommended or not, because in Australia at least, we don't get vitamin D levels paid for much anymore, but insist on getting a vitamin D level, just pay for it yourself and be reassured that if you have a reasonable vitamin D level, you may need some supplement during the winter. Now, you have a low vitamin D level, you need to treat this for so many reasons other than bone loss. So there are other things you can do, like get into weight-bearing resistance exercise, because the use of the muscle against the bone, like the resistance, is what keeps the bone almost active in its remodeling state. And you can also look at your diet. Have you got enough calcium in your diet? It's not just dairy foods, it's other high calcium foods such as nuts and seeds, and some of the nut milks are very high in calcium, which are good. And attend to your gut health. So look into why you might have IBS, and so much of it is food intolerance, which is very poorly studied. So it's up to the individual to kind of like take out certain foods and think, am I feeling better in the gut? One of the key things is bloating after meals, diarrhea after meals, or just chronic constipation. It's usually associated with food intolerance. And lastly, supplements. I don't go a lot into supplements, and I think it's as a reasonable rule is don't go over 500 milligrams of a calcium every day. There has been some studies that show if you have excess calcium supplementation, it can deposit elsewhere in the body, i.e. the arteries. And I wouldn't rely on taking the vitamin K2 to prevent that, because we don't know yet whether it really does prevent calcium deposition in arteries. We do know that it can help bone. So vitamin K2 with vitamin D and a bit of calcium. There are other nutrients too, which I do cover a lot in my book, in the third section of my book on bone health. So I hope that's been helpful today, and we'll see you next time.